Hi, I'm Giulio. I'm co-director of the Program for Disease Ecology in a Changing World at Stanford University, and I'm the co-chair of the Engineering Working Group of the Global Schistosomiasis Alliance. Today, I have the honor to introduce you to a Keystone One Health case study on Africa dam and disease for the network of NGO for neglected tropical diseases. Dams are a pillar of human civilization. They provide clean energy and critical water for people, livestock, and agriculture in the face of increasing droughts due to accelerated climate change. And yet dams can lead to undesired and neglected effects on human health and the environment caused by land use change, massive use of agrochemicals, and parasitic diseases. Schistosomiasis is a textbook example. It is a debilitating parasite disease of poverty, one of the most important among the neglected tropical diseases, and affect more than 250 million people, the vast majority school-aged children in sub-Saharan Africa, causing both acute and chronic infections, including inflammation in the liver, bladder, intestine, and organ damage. The parasite has a complex life cycle, which includes freshwater snails as an obligate intermediate host. So the parasite goes from people to snails back to people. People get infected by stepping into parasite-contaminated water for their daily chores, and in turn, when infected, they can contaminate the water with the urine and stools. Now, snail vector proliferate following dam constructions as dams, canal, and irrigated agriculture create suitable habitat for the snails to thrive. This is well shown in the video on your right, a collage of Landsat imagery showing the massive change in landscape from 1984 to 2012 following the construction of the Diama Dam in 1986 at the mouth of the Senegal River. This construction was followed up by a surge of schistosomiasis cases, making this one of the most hyperendemic regions in the world for schistosomiasis, thus touching all the vertices of the One Health triangle, where a modification of the environment increased the vector that transmit the parasites to the human population. Now, the connection between dams and schistosomiasis is scientifically very strong and documented by lots of scientific papers. And yet, schistosomiasis remains an under-recognized problem. We analyzed more than 140 environmental impact assessment of water management infrastructure from over 30 African countries. EIA is the legal procedure that is required in nearly all the African countries and beyond to predict and evaluate the significant positive and negative environmental, social, and economic effects of a proposed project or development plans before it is approved and built. Well, we found that more than 3/4 of these environmental impact assessments do not even mention schistosomiasis, making the label of neglected tropical diseases a well-deserved label for schist. This is a big problem because there are already more than 1,200 large dams in operation in Africa and more than 600 dams proposed or in construction, and an endless numbers of small reservoirs for agriculture. There is no justification that schistosomiasis transmission risk is not included into the environmental impact assessment of this water management infrastructure, because we have a wide range of interventions to reduce transmission risk in all phases of the life cycle of a water management infrastructure, for the conception, the design and authorization phase, to construction, to operation. Note that each of these phases may take years, if not decades or longer, thus providing a wide range of opportunity to design and identify engineering, environmental, and public health intervention aimed at curbing, reducing, or eliminating the risk of schistosomiasis transmission, usually at a tiny fraction of the cost of this big water management infrastructure. As the old adage says, prevention is better than cure. So to tackle this significant One Health problem, it is crucial to include a health impact assessment for schistosomiasis, and by the way, for other water-associated diseases, into the legally required environmental impact assessment of water management infrastructure in Africa. Here we can show that we can sprinkle consideration about transmission risk in all phases of the environmental impact assessment. And you can download this specific slide and the other slides at the QR code reported above. But for the sake of time here, I will only comment about the stakeholder consultation box here. If you or your institution, your NGO, has not been previously involved, public hearing is your opportunity, is when you can submit your comment and engage with environmental development and health institution to assess whether the proposed mitigation strategies, if any, are sufficient to mitigate transmission risk, and if not, how to scale them up in order to improve surveillance and control. And I stress it again, at a tiny fraction of the actual cost of this large infrastructure. The ultimate goal at the end of the day is to make schistosomiasis not as neglected anymore moving forward. So I leave you here with some potential prompted points you might want to discuss in the workshop to connect knowledge to action. And one more thing, if I can. If you are aware of environmental impact assessment reports for dams of irrigation plan in your country that we could access as a PDF, please do not hesitate to contact me at deleo@stanford.edu. Thank you very much for your attention and my best wishes for a productive workshop.